Assalamu alaikum wa rahmatullahi wa barakatuh. Our topic now will be Ospi, Objective Structure Practical Examination. It will be illustrated by me, Dr. Ayman Lashar, former fellow 2020, and head of Medical Education Training Unit at University of Bishak College of Medicine. First of all, let's start. What is objective structure practical examination? Its definition is an assessment tool in which the competence of a student is evaluated for general experiments. Ospi can also examine experimental skills better than a conventional examination. Ospi provide integration of teaching and evaluation. Ospi, it is an essential tool in which the competence of a student is evaluated for general experiments in terms of identification of, number one, equipment or accessories of experiment, number two, procedure of experiment, number three, handling of instruments, number four, making observations and results, number five, interpretation of results, number six, conclusion. Procedure of Ospi. The Ospi examination ideally consists of about more than or equal 10 stations for the examination of a particular course. Then the students are rotated through all stations with 2 to 4 minutes duration for each. Each station is designed to test a component of experimental competence. We have types of stations. Number one, procedure stations. What is the meaning of procedure station? The students are given tasks to perform on subjects or on instruments only. They are not supposed to write anything. Be careful, they are not supposed to write anything at all. Such stations, there are observers with agreed checklist to mark the student's performance. That's to say, for example, check the pulse, check the blood pressure, how to fix nasogastric tube, and so on. Simple technique observed by a faculty member. Or we have question stations in which students write the answer of an objective type question, or interpret data, or record their finding of the previous procedure stations. Be careful, it is important that the number of procedure and question stations may not be the same in their number for a single examination. It is not a rule. The ratio may be determined from the facilities, staff, and space available in the examination lab. Question station, like you can bring a photo for a technique. What is the technique? What are the uses of this technique? Precautions during performing this technique, and so on. Or you can bring an instrument and ask the student about how to use this instrument, and so on. This is the question station. Problem of conventional exams. Conventional practical examinations has several problems, especially in terms of its outcome. Although grading marking should depend only on students' competence, yet variability in experiments selected and examiners both affect grading in conventional examination. Further, the subjectivity involved in this examination also affect the correlation negatively between marks awarded by different examiners and performance of the same candidate. So, due to these problems, we replace the conventional exams by the objective structured practical examination. Advantage of Ospi, the main advantage of Ospi is that both the examination process and the examinee are evaluated by giving importance to the individual competences. Ospi can also examine experimental skills better than a conventional examination, as Ospi covers a broader range of practical skills than the conventional examination. There is objectivity in Ospi and agreed checklist, which is the key for adopting this tool in practical examination. Presence of a checklist to avoid variation between examiners. And agreed checklists are used for marking and evaluation. Similarly, there is no room for subjective questions. Only objective questions are asked in question stations. Ospi provide integration of teaching and evaluation. Usage in formative assessment can enhance teacher-student interaction. It can not only all Ospi are summative, you can use it as formative to enhance and stimulate the teacher-student discussions and interactions. Ospi can be modified easily as per institutional circumstances and need. Sometimes you can make some minor modification to the technique according to the equipment's general circumstances in your medical college or your institute. Large number of students can be tested within a relatively short time. Disadvantages of Ospi: there is risk of observer fatigue. If the observer has to record the performance of several candidates on lengthy checklists, if you have many items in the checklist and number of students is large, the fatigue of the examiner may affect his concentration in grading the students. Number two, all stations must invariably demand the same time that require careful organization. If you assign 4 minutes for every station, so you should adjust the questions according to the time. Number three, also it is considered by many that breaking clinical skills in Ospi, the students are examined for one skill, not as general examination of a patient. No, how to, for example, check pulse, how to check blood pressure, not general examination of the patient. So there are fear among some experts in medical education in breaking clinical skills into individual competencies, which may be non-meaningful in assessing a patient case. These are the references for this lecture. And at the end, thank you so much, and hope this lecture is valuable for all of you.